Got primary care? Find your way to better health with primary care by One Stop Medical. With decades of combined experience, you'll find a one-on-one relationship just like the old days, but with the convenience and technology of today. When One Stop Medical does primary care, it's the best. Call today for an appointment and find your way to healthy living. Serving Lawrenceburg, Pulaski, and Hohenwald. Phone 931-244-8220. Primary care by One Stop Medical at its best.
May is Mental Health Awareness Month, and Lawrence County is no different than any other county in America. We face mental health challenges in our youth and schools just like we will any of the large counties in the state of Tennessee, Davidson County, Shelby County, Knox County. So today we want to have an open and honest mental health discussion so that, number one, we can bring awareness to this rise of suicide in youth today, rise of all types of mental health issues and challenges that our youth face today. So to get started, I want to introduce our guests today. First, I am joined by two of our local school-based therapists, Olivia Gobble and Khearra Mosley, and thank you guys for being here with us today. And also I'm joined by Margo Simpson, a psychiatric mental health nurse practitioner who specializes in assessment, diagnosis, and treatment and management of mental health disorders. Now that's a lot, but Margo, will you simplify that for us, please?
Yes, so I have a special degree that I'm not a medical nurse practitioner, I am a psychiatric mental health nurse practitioner. So what differs me from someone you might go to that you're seeing for your high blood pressure or your diabetes is they're focusing on your physical health, which to me is important also because mental health and physical health are both equally as important. And so I work in collaboration with them. They're doing the diagnostics and doing the lab work and all that, but I am doing full assessments to make sure, checking for anxiety, depression, bipolar, ADHD, schizophrenia, eating disorders, any kind of mood disorders too also. So I do medication management, diagnosing, testing, and also do some therapy.
Okay. So, Khearra, Tennessee has seen a steady increase of what we term SI, suicide ideation, suicide attempts, depression, anxiety, emotional distress in children and adolescents within schools and rural communities. Now, I just said a lot. But explain what you and Olivia see on a daily basis in our school system that has, in the last 3 or 4 years, just increased to where Lawrence County school system has built a program and now have school-based therapists to deal with this rise of mental health.
Yeah. So I'll let Olivia talk about the program being built since that was before my time. But as far as our students and what they face, so we see lots of social media contributing to this. And this isn't always happening, of course, at school. There's a lot of things that happen outside of school on social media. And of course, they come up at school. Sometimes the schools are not able to do anything about them because they didn't happen at school. But people become aware of them. And so that does help us keep eyes on a student who's experienced those things. But things like bullying come from social media, what we call comparison culture, which is comparing yourself to everyone and everything you see. And also our kids, of course, trauma has always existed. But as a nation, I think we're becoming more aware of trauma. We have seen a rise in awareness of ACEs, which are adverse childhood experiences. So these are different types of trauma that kids experience when they are in adolescent and childhood. They also, a lot of people do have a little bit more awareness. There is somewhat of a decrease in stigma around mental health. And so there are children that feel more comfortable coming forward now. I think that is part of why there's an increase.
Yeah.
A lot of this stuff has already been there.
Right. So we're going to talk about all those individual things that you just mentioned. But Olivia, talk about the program that we have here at Lawrence County School System where we have people in place where, because the stigma of mental health isn't you know, when Margo and I are around the same age, when we were growing up, it was, rub some dirt on it, you'll be all right. You know, it's not a big deal. It's, you know, just to be honest, suck it up, move on.
Yeah.
But today, it's not dealt with that way. So talk about the program that we have here.
So the program that we have here, of course, it started, I believe, 4 years ago. And honestly, I think we're probably the only school district in the state of Tennessee that has our own in-house therapists, which a lot of school districts will contract with an agency, you know, when, I guess in some cases maybe that's Centerstone or Mental Health Co-op. It kind of depends on where your agency, where your school district's at. But so we are, so we have 5 school-based therapists who kind of divvy up between, I think we have 13 schools. And with that, we're kind of able to be kind of that, we're kind of a stationary, like we are a figure in that school.
Yeah.
Like so, and so which in a lot of cases with a lot of agencies, and I think this was the part about it was there is a lot of turnover.
That's right.
With therapists, and there's a lot of reasons for that. It's because like maybe we're not feeling so very supported. Luckily, we have a very robust program where like we feel like we are supported. If there's an issue, we can address that. And the other beauty about our program is so as the therapy supervisor, like we meet weekly, as legally we have to if we're performing any sort of clinical operation, we have to meet weekly to discuss cases and processes about that. So we are able to do that, and I think that builds up our team better. So we have a very unique opportunity here.
Yeah.
So
Yeah. So Margo, as being on the private side, these two are obviously in the school side. Other than inside the home, these guys are the first line of defense because they see kids on a daily basis. Their teachers, whether it be teachers, administration, see them on the first line of defense. How is it that where even Khearra mentioned a while ago, to where there's some things that go on to where they're not allowed to be involved. It doesn't happen at school and whatnot. So from your perspective, being on the private side, where they can be involved in school, how is it that your resources can be sought and parents be able to reach out and get to you guys?
Well, as a psychiatric mental health nurse practitioner, we deal with all age ranges, from ages 5, 6, all the way up to end of life. So a lot of times they're going into their pediatrician's office, they're doing screeners, they're doing assessments. I think most offices do a yearly suicide screener or a anxiety depression, especially as they're getting older. And a lot of kids are being brought into the pediatrician's office or to their nurse practitioner because of behavioral issues. And so if it's something that seems a little bit more than what they're comfortable with, that's when they would refer to me. And I can collaborate with them, or I can actually see the patient and do an assessment and just make sure we're not missing something like that. It could be a trauma response versus true ADHD because it all looks similar, but to the naked eye, if you don't know, and if you're not fully trained, you don't know, are we dealing with trauma, or are we dealing with ADHD, or if we're dealing with some early bipolar in teenagers, or if we're dealing with, you know, and also my thing I want to say is just to make sure that parents are open and understanding, because like you said, our generation, we were taught differently. We were taught just put some dirt on it, keep on moving. And me as a parent, I think, okay, I've been guilty of saying that too, like, oh, you're going to be fine.
Sure.
You're going to move on.
Sure.
But if your child has enough courage to come to you, take it serious. Listen to them, have that conversation. Don't be afraid to say how you're feeling. And I know we're going to touch on that a little bit of like signs to reach for, but if I can be of any help to anybody in the community, please reach out to me, like with provide a little guidance.
Well, first and foremost, that was why I wanted to break the ice with that. Because first and foremost, we want parents and grandparents, or whoever the case may be, friends, we want them to have the freedom and the availability to reach out.
Yes.
You know, and just break the stigma completely that my child, my grandchild, my friend needs help. So let's just dive right into the deep end. Trauma.
Yep.
Trauma is, from gathering from you guys or whatnot, is is as much a part of mental health or mental health disorders or contributors to. But let's just I don't want to talk about it in a generic form. Let's talk about types of trauma.
I just want to say trauma is subjective. Everyone has experienced trauma, and that's a misconception because when I am sitting with patients, I'm like, have you ever experienced trauma? No. So, okay, well, let's look at, and I know this, we're all passionate about this. What may be traumatic to me is not traumatic to her.
Yeah.
Vice versa.
There's a resilience factor.
Yes. And so what I can say, oh, that was not a big deal. She's going to be like, that was the worst thing that ever happened to me, and it's bothering her. It's changed the way her brain works. It changed her coping skills. It changed all of those things. And so that's why I want to get away from the stigma of trauma.
Okay.
Because it's not what we think. It's not just a car wreck. It's not just sexual assault. It's not just a death.
Yeah.
Big T traumas is what they
Yes.
call, is what they call them. Big T traumas. Yes.
And that's my TED talk.
So if you don't,
people don't
so
truly
if you
understand
so
trauma.
to get away from the big T, break it down.
Yeah.
Let's dive into the different things that we that we would label as a general trauma that this kid's experienced trauma in their life. So let's go down the different lanes of what that may be.
So whenever I mentioned the big T traumas and little T traumas, that's actually a wording that's used for a specific type of trauma therapy that is called EMDR, eye movement desensitization reprocessing. I know that's a mouthful, that's why we say the acronym.
Yep.
But so big T's are the things that when most people think of trauma, they think of this disastrous thing that's happened, child abuse, anything that's violent that's happened, being in war. That's what people think of. But then there's something called little T traumas that are. It could be something as simple as, in the 3rd grade, I got yelled at by a teacher, and for whatever reason, my body holds on to that instant. Now, the triggers may look different. Now, and to somebody else, that might seem like, so what? Somebody yelled at you, but your body held it. It was your body had a reaction to that incident. I mean, it could be. I mean, it could be something that small. And a lot of times in those cases, people might feel like well, I haven't experienced something big, so my thing is very, very small, and there's might be some guilt and shame attached to that. Yeah. When really it's like, no, you experienced something for whatever reason, your fluke.
It was big to you.
It was big to you for whatever
And
reason.
I think that's an important statement.
And it's changed how you may have social anxiety from it now.
Right.
You may have,
Yes.
because it's forever changed how your brain processes those interactions.
Yes.
And
So one of the things that I think has changed over the years, and Khearra, you just said something that it was big to you.
Yes.
Each individual child, adult alike, when we have things happen in our life that impacts our life. But why is it now that it's so prevalent that it almost directly everybody's dealing with some type of mental health, from not just children, adults alike, but whether it could be grief or all these different things that we do, to where, again, it's more prevalent now. Is there something that's changed in the...
So, yes and
I know
no.
you're going. Like she said, it's always been there.
It's always been present. So I'm going to use a different example because I think you'll fully understand this one. When people say, back in my day, we didn't have autism. We did have autism. We didn't have evaluations for autism.
Okay.
We didn't have a list of symptoms to look for. We didn't have pediatricians beginning screening when someone is about 1 to 2 years old to detect autism. So it's always existed, but it was not known.
Right.
So same thing with trauma. Trauma has always existed. There's always been physical abuse. If you go back generations, you probably have someone in your family who was physically abused. It was very common against women. So almost all of us probably has physical abuse in our family line. Same thing with sexual assault. As a generation, there's generational trauma as well.
Absolutely.
So you take baby boomers. Generationally, they experienced world wars, followed by Korean War, followed by all the wars subsequently.
The Vietnam War.
They've experienced all of those. And so lots and lots and lots of violence generationally for them.
Yeah.
Fast forward to millennials. We experienced Columbine. We experienced the Iraqi War, the Afghan War, the Ukraine War, Sandy Hook. So all of these things, and then all of us experienced COVID-19. And so all of those things are impactful on an individual, but also on a generational level. So every person that was touched by those events has effects from those events. Now, as we were talking about big T's and little T's and resilience, it might affect people differently. Some people are naturally have a temperament that is more resilient. So they can experience lots and lots and lots of things before it starts becoming overwhelming. Some people do not have a lot of resilience naturally. And so a couple of things happen and now they're in full-on crisis. So that varies from person to person.
Well, also we say so much negative about social media, but there is so much positive about it too, because it is bringing awareness. Plus we have the internet. Plus we have something called open evidence that's at our fingertip, and you can search every medical research journal and put it in, or diagnostic, or because we're really big into diagnostics around here in research. Where before you're having to search through books and you're not like, if I need to know something, I have it at my fingertips at all times. And so does my kids. And so they're being educated, like you said, like they're seeking it out in those times of, but we want to make sure they're seeking out the right resources and that they know the right places to go to and the right people to turn to, like who is your safe person, or who is your safe people, and those kind of things. But yes, it has its negatives and positives.
So you just took us down a road that we want to go down, which is social media and the phone. The advent of the phone and social media. Is it the root of this problem?
It is a
contributor. In today's world.
I would not say it's a root. Because how many people do you know who experience social media on a daily basis and they are not experiencing crises, and they are not experiencing more anxiety than usual, and it is not leading them to experience more depression, things like that? I think it goes back to individuals. It also goes back to consumption. The amount of consumption of anything, including social media, is going to increase its effects. So people, for example, who, you probably know people like this who say, well, I don't really even get on Facebook. I get on there maybe once a month. Well, you're also not subjecting yourself to comparison culture every single day. But if you're a person who is constantly scrolling Facebook and you're seeing everybody else and their highlight reel, because that's what people post on Facebook. They post the best 30 seconds of their life that day. And it makes it appear as if, oh, well, they've got it all together, and look what they did this weekend, and our family really should be doing that too, and why aren't we doing that? Comparison. Now you're in your head.
Well, I want to speak on getting the proper diagnosis again, because people who have ADHD are more likely to be impulsive. They're more likely to need that dopamine hit of constantly. So they're your people, they're seeking that constant entertainment because their brain is constantly moving, or they get, like you said, doom scrolling, you get so locked in on it, you've lost 2 hours and you don't know it. Or if you're depressed and you're like, you know, and you're isolating to your room, like this is your comfort. And a lot of teenagers I see seek comfort on the internet instead of getting comfort in the right places. And so that's what my point is. And people say, well, I don't want them to have that stigma of the diagnosis. My son is ADHD, as am I, as you can tell. But when he was diagnosed in 2nd grade as ADHD, the neighbor said to him, you don't have that, you're smart. And I was like, what? Like that does not mean he's not smart.
Those two couldn't go together.
Exactly.
But that was for a very long time, and I would say still to a degree.
100%.
That was a stereotype. So,
or they don't want him on medications because they think it's going to lead to addiction, and I can get into that. The studies say it prevents addiction and self-harm and all those things. But anyways, we'll get to that in a minute. But,
and I'll just full transparency from an adult perspective. So I tested gifted, and I graduated cum laude, and I graduated with my master's degree of 4.0. And throughout my life, no one ever suspected ADHD
Same.
for that reason. Well,
Same.
you're too smart, you can't have ADHD.
And you're not hyperactive, you're not
But
disruptive in the
but
classroom.
in girls, ADHD looks very different.
Very different, yes.
So fidgeting for girls looks different than the stereotype of boys is that they're going to be up and bouncing off the walls and they're going to be disrupting your class. But girls do something called masking. And so they're more likely to be compliant
Or the perfectionism.
or the perfectionism,
The
but
overachiever.
also those are their presentation of symptoms.
Yeah.
And so even just helping parents be aware of those things,
Yeah.
because even gender can be impactful in a diagnosis and
Absolutely.
in observing my child might be dealing with this.
Yeah. Yeah. So Olivia, let's go. Let's start at say middle school, from a 6th grade kid to high school.
Okay.
Run me through the traps that social media has for them, whether it be on Snapchat, Facebook, Instagram, Twitter, all those things where, yes, there's a lot of good things that it offers.
Yeah.
But run me through the traps where, again, from a 6th grader all the way through a high school to where they can just simply be, I mean, again, terms that I hear, and it's not mine and your generation for sure. So, and I'm not a social media person necessarily, but like you hear kids getting in trouble, whether it be they're getting catfished by friends where they think that they're talking to this person, but they're really not.
Yeah.
And,
Yeah.
and it could just be as simple as they just go through there and they think, why don't I look like this? Or, you know, how can I be like this? Or this group I'd love to be in, but I'm not. So run me through
if
that.
I'm left on opened, that's
Yeah.
bad.
Yeah.
And you're valuing your worth on if I'm left on open or if I'm left on red.
Yeah, we're left on red.
I mean,
But-
and like,
and it's funny because as adults, I know if I'm left on red, it's because my friends are real busy.
exactly the same. And like, you can
And
text me. and
It's not intentional.
Can I ask a question? Because
we're
again, I don't
ADHD,
know.
we may have
what
looked
is
at it and
left
not
on
re-
open or left on red?
So
mean?
on your, do you have an iPhone?
I have an iPhone.
Okay, so when you send a message on iPhone, if you were to text me right now,
Okay.
unless you've turned this feature off, you text me, I open your message.
Okay.
Okay, and with the most love in my heart that I can muster, mentally I texted you back.
Yes.
Okay.
But you forgot to fit.
Yeah,
to
but
do it and hit
because I have
send.
ADHD, I indeed did not text you back.
Because you moved on to
Because then I
something
was
else.
like, oh, I got to get back to that email.
Right.
So on your iPhone, where you sent me a message, underneath the message it will say, read at 9:52 a.m.
Okay. I got you.
And
I
she
got
didn't
you.
reply.
And
so-
I don't reply for 10,
Okay.
15, 20 minutes.
and it's the
you're
same
like,
on Snap, right? Can it
Yes.
show
And,
right?
Snapchat shows
you
too.
guys say that winds. I mean that.
Oh,
that's
yes,
an issue.
Yes,
It's a big issue.
because there are people who leave people on red on purpose. It's passive aggressiveness is what we call
Okay.
it. Overall, I don't think that's the intent. But there are some people, like with everything, there's good, then there's bad. Some people intentionally will leave people on red, almost like I'm gonna cold shoulder you through texting.
Okay.
I was about to say, may I? So the like, cause yeah, and y'all were bringing up very good examples of what I was fixing to bring up. So, cause full disclosure, I don't have Snapchat, I don't have TikTok. I barely, like, I have to get most of my knowledge from the kids I work with. But what I have noticed in working with them, so we use a lot of what's called CBT, cognitive behavioral therapy. Now, that's pretty much one of your basic clinical therapies when you're working with mental health. And the idea being that we have negative automatic thinking. Everybody has that.
Yes.
I have it, Khearra, everybody's got it, you've got it. And with social media, when we see something and our brain just automatically decides, I'm going to have this thought right here, a comparison thought maybe, and that negative automatic thought goes unchecked.
Yes.
You don't question it. You just let it go. Well, then that feeds into negative, for what I like to call hard to have feelings or negative emotions, and then that goes into maybe I might react in a way that's not appropriate, either underreacting or overreacting, and the cycle continues. So it's kind of where it leaks. So, and if we do start that even in 6th grade, or with 11, 12-year-olds, and continuing that on again unchecked, like that really presents very problematic thought concepts and core beliefs about yourself and your life and your future
Absolutely.
as you get old. I mean, even into high school, as a senior in high school.
Yep.
So, obviously, I'm Gen X and you're Gen X and we have millennials in here, but growing up where from the time you could comprehend having a tablet in your hand, getting a phone, is that where we were different, I mean, we were out and about running around in town. You had to have a quarter, stop at a payphone.
But we had our pager.
Right, we had a pager. I guess what I'm trying to ask is that putting it in their hands too soon, a contributor to the need to always have that?
And I was about to say, it's not just social media. It's also the device itself.
Yes.
That's my question.
That's
my question.
I mean, like even just functions on your smartphone are just very. It's kind of built to be where the gaze goes there. There was a psychologist I talked to, this was many years ago, who's with the Center of Excellence in Vanderbilt. Like this is disrupting our delay of instant gratification.
It is.
Yes.
Our reward center is being stimulated constantly, and so you can't get it naturally.
Yes.
I guess.
Instant gratification is what it sounds like. That means bam, satisfaction. So when people can't wait at all, it's because they're used to everything is right at their fingertips, which again can be good. Having information readily available is invaluable.
Yes.
Sure.
Yes.
But having access to people all the time and never taking a moment to exist alone is very harmful. It's very, very harmful.
Now, beyond the mental health issues that can be derived from it, I think there's a lot of other issues that these generations struggle with. Communicating.
Yes.
Yeah.
Yes.
I mean, again, we had to talk on the phone. There wasn't text
You
messages.
had to work up the courage to call someone.
Yes. Yeah. And then
what if their parents answered?
absolutely. I was just about to say that. I mean, if you were a kid of the high school in the 90s like I was, and you wanted to call and talk to a girl, and you picked up the phone, you were scared to death if her dad answered.
Absolutely. I was scared if my dad answered when the boy called me.
Right.
Yeah.
So getting back to that, I mean, there's a lot of other issues that I believe that it leads to, that would lead to
Absolutely.
struggles,
Yes.
mental health issues, because you can't communicate. If you can't communicate with people, openly and being able to have a conversation and being able to communicate on a level, that has to bring anxiety.
Yeah, absolutely.
So talk to me about just simply getting back to the basics of being able to have conversations with people and getting away from the devices so that we can be able to interact.
Yeah.
Well, I want to speak on a parent's side because I'm raising my first child. She's almost 26, so we just got into like the cell phone era when it really started coming on as far as like getting social media. And I can remember when Snapchat came and the whole social media, and then I still have one in high school. But my thing with them is always, when you're getting your hair done, when you're getting put your phone down and communicate with the person you're talking to. And I also taught clinicals at UNA for several years, and I noticed on campus that when I was in college, and we became friends with the people we sat around. Wow, y'all may have had your cell phones by then, but we didn't. And so you had to talk to the people sitting around you.
Yes.
Now they don't. They're in their phones, they have their earbuds on, they're not communicating on campus, they're not. That was a really big eye-opener to me when we talked about communication. It's just your peer group. And like, but it's safe to be with your earbuds on and in your phone. You don't have to put yourself out there, and you don't have to, just those kind of things. And
Yeah.
so
on a daily basis, for you two, tell me commonly when you have students come to you with issues, tell me commonly what you're seeing, whether it be bullying, whether it be, somebody posted this about me and they used an AI image and now I'm, it's running around in the truck.
Yeah.
But let's still down that road for a minute.
Well, I want to start by saying, because how our program works is, as if you were going to an outpatient clinic, we have a process of how you come into our program. So hopefully this will answer your question. So we have a process, like there has to be kind of a reason for referral. And so to answer that, most of the time it usually dings up anxiety or they've had trauma. And so whenever we see students, like, it's because we're seeing a trend of this. Hopefully mental health therapy will be the answer to this issue. And most of the time I would say it is anxiety based. Not being able to not know how to be very, very shy, not know how to communicate with people, or like whenever we have a test we break down more than what would be typical.
Yes.
Not being able to, and you bring up the resiliency point, one of my favorite words, but not being able to bounce back as quickly as probably should. That's probably the majority of it. But how people see that, it's through behavior.
Which is what I primarily see because I've been in the elementary schools. And so lots of things that are behavior that actually are coming from a different issue.
Absolutely.
So your issues are more with you being in elementary school and you've been in high school.
They look a little different.
You may see more issues involved with friends, and you probably deal with more issues coming from home. Would you say that?
Home.
Am I right?
I was gonna say.
Am I right in saying
I'd say
that?
it's pretty
Yeah,
even. I'd say it's pretty even.
Okay.
Yeah.
These kids have just made it too.
Yeah,
Yes,
Okay.
it just looks different through the lifespan.
Yeah.
Okay.
So at the point that they're with me, usually I get things that are, well, they have this behavior, and then I start investigating, and this behavior is coming from lack of emotional regulation skills. So they do feel anxious, but nobody's ever realized that that's what it is. Because we have expectations of elementary students. Sometimes it's anxiety, sometimes it's anger, sometimes there is trauma that's causing a trauma response. Other things might be undiagnosed ADHD. But all of those things have an emotional regulation component, which means this kid is not able to bring their emotions back down to a baseline without assistance. And that can come from overuse of cell phones. And some of my kids, even though I have elementary students, for example, I have a pre-K through 8 at New Prospect, and I have kids that are in 5th through 8th grade that are already on social media. They have a crazy amount of access to cell phone time.
Sure.
Well,
they have. Let's just be real. They just give them, put it in their hand, and it's free for all.
Yeah.
Just use it all you want to.
I have pediatric patients that can't sleep at night, but they're going to bed with a tablet
Yeah.
with no monitoring.
Yes.
And so with that brain that will not turn off, they can scroll while everybody else is sleeping because it's constantly being stimulated.
Yes.
And then the next day they're sleepy and they're irritable because
Yes.
they're not sleeping.
Exactly.
And so you say we need to limit screen time. Well, then they get upset. The kids do, and I'm like, well.
Listen. Hey, listen.
It's
As
okay for them.
parent-
Yeah,
as
it's okay for them to be
parents,
upset.
Listen, as parents, how easy is it to go here?
Yes.
Yes.
I'm going to go do this.
I do that
or
as a
I'm gonna do that.
grandparent.
Sure.
Yeah.
Sure.
But
And when they have that constant access to a device, the constant access, emphasis on constant, because there are parents that set limits,
Yeah,
and you see a very big
So
difference.
let me ask that question. All three of you guys are trained to be in this. What is an adequate amount of time? And tell me what you would suggest as far as usage for, a tablet, a phone, whether it be, tell me when you think social media is appropriate. Tell me when it's not. So talk about that.
Yeah, so I can't separate this from being a parent. Also,
I was gonna say, as a
so
parent.
of course, there is research on these things, but then there's also your individual child. So what works for my family, I don't think that if you are spending an hour on a phone, you need to match that with an hour of a different activity, whether that's family coming together and playing a board game, whether that's kids going to read, whether that's kids going outside to play. But an hour for an hour is what I think is appropriate, taking what I know professionally and also what I know about my own children.
I just know as a parent of an ADHD child, he could not have a TV to go to sleep. He could not have a tablet to go to sleep. We had to do an hour before to kind of do a wind down time. But he also, on the other side, loved to be outside and be active because
Sure.
he had that
Yes.
hyperactivity. So that wasn't a big issue.
Yes.
But also as a grandmother, I can see like when my grandson has too much tablet time, he gets irritable, he gets angry, he gets, because he's only 4, which he has limits. and so now he doesn't have one at all, and he's done so much better. I mean, but then there's other kids, my other 2 children who don't struggle with him, did fine with theirs and didn't have a problem. That's why she's saying, be individualized, know your child.
Yes.
But also, me as a parent, I don't think they need a cell phone until they're staying after school activities.
Yes.
Like, who do you, or if they're, well, and 2 nowadays, there's not home phones. I don't know about
Right.
here.
Yeah.
So my younger son had to have a little access sooner.
Yes.
Than, you know, but there's ways to get around it. I'm just saying use it.
Yes.
And use your, there's a lot of parent locks and those kind of things now available, and no. But with Snapchat, it is a very bad evil as far as like everything can be hidden
Yes.
and everything can be deleted and everything. You don't have as much access as we did when that came on the scene.
Yeah.
I can't say, I mean, of course, I can't speak personally, but like I have noticed, like just the longer that you just delay the access, I mean, that's like, well, they didn't get a cell phone until they were like 14.
Yeah, that,
I mean, they're
that's
just putting that on.
Snapchat's an app. I
Right,
don't
yeah.
think that they need.
Right, yeah.
That's correct.
I agree with that.
Yes.
Because again, when
Now
you
that's not
when
going to be a
you-
popular opinion.
It's not.
Well,
But
hey.
it is scientifically
My-
based.
my
And I'm
children are gonna cringe.
I'll explain why it's scientifically based.
It's the
so
reality.
This part of your brain is your prefrontal cortex, and it controls your impulses. Your prefrontal cortex develops your entire life, okay, into adulthood. So a 5th grader has a very underdeveloped prefrontal cortex, which means they don't have a lot of impulse control. Now, if they come to us in therapy, we're going to start teaching them some skills that will help build that. But most kids aren't coming to therapy and learning impulse control skills.
Yeah.
It's just developing through the lifespan. So if you're handing an impulsive human Snapchat, which messages can be hidden, if I screenshot your bullying messages, you're going to know because it tells you I screenshotted it. So there's all these things that are negative about Snapchat for an underdeveloped brain. So you're giving access, let's say to 5th graders, because I've had students on my caseload that had it in 5th grade. You are literally setting them up to experience those
And
things.
they make the app makes it appealing because you can do funny faces on it, and you can do. I mean, even my grandson likes to get on his aunts and
Yeah.
uncles because he can do the funny
filters.
face. Yeah, and so it's and there's algorithms. These people who are creating these sit and develop to make these things attractive.
Yes.
Sure they do.
Yes.
And to know what will, you know.
And I don't want to sound like we're
No.
just,
Well, listen.
killing
let's just-
Snapchat over
no,
here.
Listen,
because
let's just
Snapchat
be real.
can be positive.
Yes,
Sure, let's
just
absolutely.
like everything that we're talking about can be positive.
Yes. Again.
But parents have to understand
too, yeah.
the role that they have in monitoring these things and setting limits is so invaluable. And their comfortability with saying no, no is a complete sentence.
Yeah, yes.
You are the parent. It's your literal job to raise a human up to be a good human. So take away access to things that are hindering that ability.
Yeah.
It's okay. They can
Yeah.
be upset. It's okay for humans to have emotions.
Yeah,
Sure.
I think a
It's
lot.
okay to say no.
Yeah,
It is.
I think a lot of parents, like, they feel very uncomfortable telling people. They feel very like, I don't want my child to be distressed. So I think we have this misunderstanding of like, oh, I have to tell them no. Well, now they break down and are like upset. And there's this disconnect of like, but that needs to happen.
Yes.
Your child being upset, I mean, as much like if I'm listen, because I get upset, I'm human. Then I have to learn or use the skills that
To regulate.
Yes.
to regulate myself.
Yes.
I don't learn that if the trigger's taken away.
Exactly.
Well, my favorite that my children use, but I'm the only one that wouldn't have it. All of my friends have it because they think that I care. That
Yeah.
they're the only ones.
Yeah.
You know, but some parents may, I don't want my child to be left out. I don't want them to be bullied because
yeah.
they don't have it.
Yeah.
Or,
Yeah, and I understand that.
you know, but I'm saying it's okay if they don't.
Yes, yeah.
Absolutely.
It's okay if they don't.
But I parent different, so.
Well, you know, going back to, again, I'm going back to my time growing up. There's an old saying that I've heard a lot of times. It says that where a parent says there's 2 schools of thought when it comes to whipping your kids. All right, so that's in the 90s, whipping your kids. Now, again, I think wood therapy is a good thing. I mean, I grew up with it. I mean, it got my attention. You guys may have a different opinion. That's your opinion. But I've heard it said many times of talking about, kids and getting in trouble, like if you whip a kid, you're going to warp their brain. Well, my problem is this. If I don't, they're going to warp my brain. So where I'm going with this is that where and how did we get to the point to where we are scared to death to parent kids? To where I'm not saying that we have to. I'm not saying we have to whip our kids again.
Yeah.
I hope you hear what I'm saying and not what I'm not saying.
Yeah.
Well, we can use the
But
word
why are we
discipline.
afraid?
We'll use the word discipline.
Why
We'll use
are
the
we
word
afraid to
discipline.
discipline our
So,
kids? Whether it be you can't do this.
I think this is one of those things where there was a pendulum swing and it was too far this way. Like with a lot of things that happens. And so a term came up several years ago, and it was what we call a misnomer, which is where it's named incorrectly. It was named in a way that sends the wrong understanding of what it is. And that term is gentle parenting. When people hear gentle parenting, what they actually hear is permissive parenting. That is absolutely not what gentle parenting is. Gentle parenting is, I'm not going to hit you. I don't need to physically touch you in order to discipline you. The word discipline literally means to teach. I don't need to be physical with you to teach. What I do need to do is be firm, fair, and consistent. That is actually what gentle parenting is supposed to be. I think that a lot of people swung all the way over here when they heard that term because they misunderstood it as permissive parenting. So now there is a lot of permissive parenting. There are people who are like, well, I can't say no because this. And actually you can say no and you need to.
Right.
You need to say no. You need to set limits that are reasonable. You need to set realistic expectations. You need to set firm, clear boundaries with your children. And they're going to get upset. That is okay. It's okay for humans to have emotions. If your children are never upset because you're permissive, and then they grow up, then they get a job, and the boss says, well, you have to do this thing. Well, they don't want to do that thing.
Right.
And they've never been told no, or they've never had someone follow through with giving them instruction. They're going to fail. They're not going to be able to hold a job. They're not going to be able to get a formal education if that's the choice that they take. Even in a trade school, they're not going to be able to be successful there. They have to be able to function in society, and that includes having emotions and being able to cope with them.
Or in relationships.
Or
As
in
adults.
relationships. Healthy relationships come from healthy brains. Brains that have been told no and held accountable are able to have healthy communication in relationships.
Yeah. You said that way better than I could ever say it. Okay. Another lane that leads to this, substance abuse. We live in rural Tennessee. Income has effect on substance abuse. Now, fortunately for us, we don't live in a poor county. Sure, is there parts of it?
Yes.
Absolutely. So let's talk about substance abuse, whether it starting in the home, kids starting vaping at a young age, seeing, they're just around the environment. Talk about how substance abuse, whether it be what they've seen growing up, whether they're involved in it, how it affects them, affects their mental health, how it affects just their daily life.
This is something I can talk on for hours because substance abuse does not discriminate. It does not care if you have a good job. It doesn't care if you have education. It doesn't care if you're unemployed and low income. But there's lots of studies, and I'm a research-based person, and I love evidence, and I love to treat appropriately. But it's shown that a lot of people with substance use disorder have mental illness. Did the mental illness cause the substance use disorder? That's where I come in. Or did the substance use disorder become a problem because of the mental illness. And so back to our ADHD brains, a lot of kids are vaping because that's a stimulant. So they're looking for that stimulant to treat their brain because they're not getting the medication they need. Or they're looking for an Alani, or they're looking for a Monster drink, or anything like that. Then we have anxiety because your anxiety is not getting treated appropriately. You're treating it with alcohol because it's calming. It calms your brain. So you have all these things going on in your brain and these neuroreceptors being altered, and your body will find a way to treat it, whether it's treated correctly through therapy or medication or a substance. And so I'm usually seeing people on the other end of the spectrum where they can't keep their job anymore because the alcohol abuse is getting so much, or we're trying to get into recovery, and so I'm having to treat them with the correct medications then. And so that's why I want to push is like, hey, get them in therapy, get them the correct diagnosis, and get their little brains treated the right way so they're not trying to seek those behaviors.
Right.
And with suicide, people with ADHD are more likely to commit suicide because you're impulsive. You're not thinking it through. And like she talked about, your little brain is not developed until you're 25. And starting substance use earlier delays brain development. So it's just such a caveat, and it's so not talked about because like we, as that generation, oh, you're just partying.
Yeah.
Oh, you're just going out to
Absolutely.
the field and drinking, or you're just doing this or doing that. And that may be the case for some of us, but then there's the others that once they start it, they can't stop. They're sitting in their dorm room alone drinking.
Yeah.
And here's the thing with that. You're rolling a dice.
Yes.
Because
Yes.
you don't know if you're the person who can
Yeah.
or the person who can't.
Yes.
Yeah. Well, I mean, even inside a family, because it's
Oh,
hereditary.
absolutely. It is.
You know, the abuse. I mean, I've seen in my own family where, you know, you have people who can socially drink, and you have people who absolutely cannot.
Yeah.
But I think I see more in today's youth. I think it's more prevalent today
Well, it's
than it
easier
is.
to access.
There you go. There you go. So,
Where before I had to try to find somebody to buy me
Yes.
alcohol.
Yes.
Yeah.
Now you can text
you can
somebody.
walk in a convenience store.
Not
They-
even just that.
They can
but-
make their own fake IDs. They
Yeah.
can.
Yeah.
Yeah.
Yeah. So, what are the signs? Tell me the signs. Tell me, you're sitting here today and dealing with kids and whatnot. Tell me the physical signs. Tell me the mental things that you notice, the emotional things that you notice, that are indicators that we just overlook all the time. You know, again, it's for a parent who sees your kid every day. You know, it's that frog in the boiling water. You know, you don't notice it until it's too late.
Yeah.
So, talk about that.
I was going to say, well, I mean, you mentioned the frog in boiling water. In a lot of cases, it is like that. I've been a facilitator for youth mental health first aid. One of the biggest ones is like if you notice any change from what they have been. So that requires you having to know them before, and like. And I can't preface that enough. It's like just notice. It's just start paying attention.
Can I piggyback
Yes.
real quick and
Yes.
then you'll pick back up?
Yes.
That involves a parent being present. Meaning, when you're at home and you're talking to your kid after school every day, you can't be modeling doom scrolling. You can't be modeling, hang on, let me check on Facebook. You can't be modeling your face in your phone and then also notice these things that she's talking about.
That's a great point.
Yes.
That's a
Yes.
that's a really good point.
And I guess it's as just a part of that. So those changes, like, I mean, obviously, if we're going through puberty, and yes, we used to love Barbie dolls, but now we're getting into boys or something else. Like, it's one of the things that I look for is like, or when somebody says, "Oh, well, they used to do this, but now they do this." It's like, well, that sounds developmentally appropriate. The issue is if they don't replace. That's one of the, I think that's one of the bigger indicators for me.
Yeah.
Is like not replacing an interest. Oh, they used to be playing with trucks. Now they're into tennis, or like, but now they don't have anything.
Yeah.
And so it's just noticing, being present, and just kind of just being there. Yeah.
I would say isolating more in their rooms, which is still a teenager thing.
Yes.
Yes.
But not going out with friends like they used to, not interacting. Because when we're doing a depression screening, it's like have you lost interest in things you used to enjoy? You know, like she described, or if they're changing friend groups, or if they are more irritable, or if they're more easily, like if they're sleeping more than normal, or they're not sleeping as much as normal. Just noticing, like she said, their day-to-day life, or if they were really active in sports and they decide all of a sudden they're not going to, and they just do nothing,
And they don't replace it.
weight loss, weight gain, or if they're getting into trouble more often, they're doing that more, what we say, riskier behavior, as far as like sexually acting out, being more riskier, using drugs or substance use, just something like that. Notice what's going on. Sometimes it's not just typical teen behavior. And it's okay to have the conversation to say the word suicide. To say, are you having thoughts that you want to hurt yourself? Are you having thoughts that you want to hurt other people? Just because you say it doesn't mean you're planning it.
Because I think, I'm glad you brought that up, because I think there is a paranoia of that discussion.
Or to say, are you depressed? Are you anxious? Can you express? And a lot of times they can't even express their feelings. They don't know how they feel. They just know something's not right.
Listen, as adults in our lives, there's times that we can't express
Exactly.
ourselves. We can't explain why I feel the way I do. You know, so that's a good point, and I want you to continue on that, because I think it's important that as we're talking about this, and again, that's at the worst case when we get to that point that we have to have that conversation. But from the first thing that a parent notices or a teacher notices or whatnot, the biggest thing you guys are saying to me is communication and being involved. So I want to roadmap that literally from the first signs to what we would call the scariest moments to have that.
You don't even, I want to just stress, don't wait until this happens.
Don't let it build up.
Make this a routine conversation in your home. Like if you talk, because we were taught not to talk about our mental illness.
Sure.
These parents are still struggling with this. They're still struggling with anxiety and depression. They're still struggling with all these things. And if you are honest about yourself, these kids are going to be more honest. And if you seek help, and if you go to therapy and you do all the things, it kind of, like you said, breaks the generational curse, and it helps them to see that your mental health is as important as your physical health, because they're going to pediatrician visits and they're going, but just to say, hey, if you don't feel like talking about it with me, who is your safe person? It could be a trusted family member, it could be a trusted friend, not just a random friend. It could be someone at school, it might not even be their counselor. Every child in their life has somebody they feel safe with. And I'm not saying just say it, but just have this routine at the table. If you ever start having this feeling, this is what you do. Don't wait till the signs. No, this is and that's where they come with good education. The school system is like, because the kids are hearing it, but it needs to be okay to hear it from the parents.
And I love that you brought that up, because so even as a part-time private practice practitioner, you know, even like when you're like, hey, I want my kid to go to therapy, like, so usually that's often, I mean, the parents have to agree for them to come see us, obviously, is a lot of times, like, we would like for, like, what sort of therapy are you doing for you? Because in modeling that behavior, like I'm taking care of myself. So I want you to kind of take care of you. So you're actually encouraging even just lifelong, you may not be in therapy for the rest of your life, but that way you have a very good relationship for as that child gets much older, or they go into adulthood. Hey, something's came up. I need to address that. I feel comfortable addressing this. But to go back to the suicide piece, like just being comfortable asking those questions, and like and also recognizing, like, hey, and even saying maybe to the kid, hey, this is going to be kind of hard for me.
Absolutely.
That's okay. That's okay. And like, hey, I just like, I'm concerned about you, and I want to ask this. I want to ask, are you thinking of killing yourself? Or hey, or are you experiencing any depression? Or are you experiencing any anxiety?
And that's a hard question for a parent to ask.
It is.
I mean, it really is, because first off, a parent doesn't want to think that my child, that's where they're at.
No, nobody does.
It's scary because you don't necessarily want the answer.
That's exactly right.
But it still has to be asked, because the answer is going to be the answer, whether you ask it or not. The difference in you not asking is, are they going to say it, or are they just going to do it? And if you open up the discussion,
and most of the times when they
they're going to
do
talk
say
about
it, people don't know it's going to happen. That's the hard factor, and then you say, I wish I would have asked those questions.
Yeah. Yeah. Because, and again, when I ask you guys to roadmap it, there's so many steps that are overlooked to get to that point. So, and it starts with early communication. It starts with parents being involved.
Yes.
And all those things. But let's say you have a kid that, didn't grow up in a traditional home. Maybe they're not even living with a parent. Maybe they're staying with an aunt or an uncle or whatever the case may be. How is it that as a community, as teachers, as just people surrounding kids, how is it that we can get involved? How can we notice and how do we step up and say, we need to do something, or we need to be involved. We need somebody to check on this kid or monitor this kid or whatever the case may be.
I think personally there needs to be more community outreach. Put the numbers out there, put 911, put 988. Let kids know that there's a crisis hotline. Let parents know there's a crisis hotline. Just because you call them or text them doesn't mean this is an automatic hospital admission.
Yeah.
It means that's somebody there in that moment that can help you handle that issue that's non-judgmental.
Yes.
That doesn't know the situation and it's somebody you can reach out to, and that since they do have cell phones in their hand, every child should have that in their phone. Even if it's not for them, it's for a friend.
Yeah.
Like, hey, we could do this, but like mental health needs to be the awareness as much as it is we're celebrating sports.
Yeah.
We're celebrating this, we're celebrating that. And it's just not anywhere in the country.
Yeah.
These are just huge gains that can be made, and just suicide walks to bring awareness. Like UNA does a huge event and raises money and just awareness because everyone is touched by it.
Yes.
Yes.
Well, you mentioned a while ago about from the mental side to the physical side. If you aren't mentally well,
Yeah.
it's physically going to show up.
Yeah.
Absolutely.
Absolutely.
So,
And that goes back to ACEs.
and so, and that was another thing I want to talk about, because kids do a great job of covering that up.
Yes.
But I believe so. Because they can say, hey, maybe I want to lose a few pounds, or maybe even on the boys' side, maybe I want to go work out. Maybe in my mind, I need to compensate for something I'm struggling with. So those are issues, obviously, on the physical side that parents need to pay attention to. So can y'all kind of just quickly elaborate on that?
Yeah, so the first example you gave of like, I just need to lose a few pounds. I have seen that within our school system. And luckily, a parent was observant and did say, this is a concern for me. This child at this age should not be dealing with these types of things. And so reached out for us and allowed us to help. And it literally just took a conversation. And so with those things, even if it's one thing, because that was just one thing, like there's something going on here that doesn't look right. Okay, tell us. Communicate with the teacher. If you don't exactly know how to reach out to school-based therapy, call your school counselor.
Yes.
Our school counselors are wonderful.
Yes.
If you call a school counselor and say, hey, my child at your school is dealing with this, they're going to say, oh, we have a school-based therapy program. Would you be interested in me making a referral for your child? Absolutely, says that parent. And that's how we get the ball rolling.
Yeah.
And our school counselors, and we even have school social workers, their job is like, they're a great resource of like, hey, you may not know where to go. I can be the first stop, so we can kind of direct you where to go. And so,
While we're dealing with that, I want to point out something because, listen, here's the reality. A lot of parents don't trust people in the school system. A lot of parents don't trust,
That's fair.
Or medical providers.
Or medical providers. There is a huge disconnect that's starting to begin over the last few years between parents thinking, I know everything, or versus whatnot. And that sounded terrible, but my point is that if you have a kid that you notice something and you make a phone call to the house that says, hey, we're seeing these behaviors, whatnot, and you have a parent that says, you're wrong. You're 100% wrong. What do you do?
well, I think, can I say
You
say
can,
something?
and then I will.
Okay, it's good. in my experience, I let them know, hey, we have this amazing program. We're in-house. And they love that because, I have no intentions of leaving. Like I said, we don't have
Well, and they don't have to take off work.
We don't have the
kids
time.
aren't missing school.
We don't have the high turnover either. It's pretty consistent therapists.
Right.
And I explained, like, I am a school employee, but I'm a licensed clinical therapist. I honestly don't have this is just for me. I honestly don't have the pushback from parents viewing me as a school employee, even though they know it.
Yes.
I've made that very
Yes.
clear, very adamant. Like our consents and everything has the Lawrence County school system logo on it. For whatever reason, I think they somewhat understand the difference. This is a mental health provider.
And in the end, these parents love their children,
Exactly,
and
yes.
they want
Absolutely.
what's best
Yes.
for them, and they're
Yes.
going to go and
And-
just that. Okay, I'm not alone.
Yes.
Just understanding there is people that's willing to help.
Right.
Yes.
I do hear that, like of the disconnect of like, oh, so and so is the enemy, but I think it starts with us. Whoever's noticing that disconnect, just addressing it right there. And like, hey, well, that's awful. You've had this experience with a teacher. Like, what can I help to talk about that? What can I help to foster that communication, because your kid is going to be coming to that class anyway.
Right, exactly.
We can't always
Yes.
get them out of that class, and then we get this. There goes, and like we can't take away the triggers, and we got to be able to build that distress tolerance
Yes.
and endurance.
Absolutely.
So, you said something you wanted to pick up.
I lost
Probably
it.
lost it.
Sorry, I'm
That's
sorry.
okay. I got locked
I bet it was
in.
good. I bet it was
I got
good.
locked in what you were saying, and it was
listen,
great.
we're going to keep it.
It was great.
We're going to kind of stay on the same topic because, what if it's a friend that's noticing the behaviors, or a buddy? They're not seeing it, but yet I don't want to say nothing because I'm worried.
Or they're
that
afraid
they're going to get in trouble,
or they're afraid their friend will be mad at
or
them.
they'll be mad at them or whatnot. Right. So that has to be a contributing factor, that if we could get kids to understand that, listen, you are better off to say something
Yes.
and you be wrong versus you not say something
Yes.
and then you be right.
Because
Yes.
it may just be a gentle conversation with the child, and it be nothing. But that's where they come in with their screeners and their like, hey, just know we're here if you need
Absolutely.
us. And you would always rather it be nothing than something.
Absolutely.
This might be just a little bit, just a little bit off topic, but just to be on that, like I've had, and this is my experience, I've had students that are not even attached to me reach out to me and say, I'm concerned about this person. And I have to praise them because,
Absolutely.
like, I'm sorry, that may make me a little emotional, but like, just of them, like, hey, they're like, I don't know if you see this person or not, which they wouldn't, but like, they're like, but I'm concerned about this. I was like, well, let me get all this information from you, like, as far as what you know about this person, and then we can kind of investigate. Hey, you did an awesome thing.
Absolutely.
Yeah.
And so, I don't want to encourage them to do that more often.
Yes.
And like, hey, what you just did, encourage your friends to do the same.
Absolutely.
And so,
I was literally just,
That's what I was gonna say.
what I was going to say is almost that.
Yeah.
Anyone can make a therapy referral.
Yep, anyone.
You can even make it anonymously if you want
And
to.
a lot of times kids will disclose to their friends more than they will their parents or a teacher or whatever. So a friend is a valuable resource.
Yes.
But like I said, make sure it's someone, a trusted friend that's not going to encourage you negatively, you
Yes.
know.
Yes.
And that's
Right.
another way of just being involved in your child's life and know who they're with and what they're.
Well, and to be honest with you, this part I'm about to bring up, I don't even know that we'll include it. Maybe we will, maybe we won't. But thinking about along the same lines where you've got a friend that recognizes maybe a kid's been abused or substance abuse or they're dealing with trouble. Or I'm going to bring up a new topic. How this has started happening in America that you hear about every single day, where a adult teacher is involved with students, to where students are, not that but there's a good chance that there's more than one kid that knows about
Well,
it.
and they
Yes.
see the signs.
And they see the signs and whatnot. So, and even that, because really think about the damage that's going to do, and you see it every day.
Yeah.
So I genuinely, when I ask the conversation, How did that become? How did that start?
Boundaries.
I know.
The
lack of boundaries.
The lack of boundaries, and because even if it's something not sinister, I think a lot of times we get confused, and I say, well, and I shouldn't say we, because I know that for us, our ethics are different from a lot of educators, and this is not to say that their ethics are bad, but there's not very clear descriptors of what the boundaries looks like in order for it to be ethical.
She's referring to our code of ethics.
A code of
Sure.
ethics. So because for different professions they have, I mean it's all kind of written differently but the same. And for ours it's very, very clear. We don't have friendships with the people that we work with. As much as our kids, I probably sound awful to my students sometimes, like as much as like, well, you're my best friend, you're my therapist, and I have to go, I'm sorry, no, you're not. You're not my best friend, because this is my job. This is what this is, and I explain what that looks like. But what I do run into is kids having a friendship with their teachers, or just something that's maybe they're like, hey. And I think it comes from a good place. They want to make sure that student is doing okay, but they friend them on Facebook. They get involved with their social media, and that's
And let's
concerning.
make this very clear. It's 100% the adult's problem.
Absolutely.
Right, yes.
100%.
Yes.
It's 100%.
And it will, but I've also had kids like, oh, can you add me on Xbox?
Yeah.
Can you be on Xbox Live? And like, no, I'm not going to.
Right.
So you might have a kid that, because maybe their home life is not very great.
Yeah.
Sure.
And so they are seeking that adult. That's not an opportunity for you to be a friend. That's an opportunity for you to be an adult and show what an adult what that looks like.
Absolutely.
That's right.
And so, I think it goes back to that parenting thing. Like, I don't want to tell them no. I don't want to make them uncomfortable. Like, unfortunately, this is where you still have to be the adult.
Or I'm all they have, or they.
And yes, and
comfortable with it,
I totally get that. But that can put you also in a very awkward place of like,
Yeah.
didn't anticipate.
And it's a slippery slope.
It's slippery
Yes.
slope.
Sure.
Yes.
Yeah.
And from the adult, whether it be, because you see it with coaches, you see it with whatever the case may be, they have to be smart enough to say, I'm not going to ever
Yeah.
put myself in that situation.
Yes.
Absolutely.
You know, and you can't. Now again, sure, parents allow kids to do a lot of things on social media to put themselves out there, to expose themselves. Now, that's a separate issue.
Yes.
Yeah.
But it still goes back to the adult has to be the adult.
Yes.
And the adult has to separate themselves from the kid from that.
Yes.
You can be a solid object. You can be, which is just another word for being that support. You can be a role model. You don't have to. You don't have to have a peer-to-peer relationship.
Sure.
Yeah.
And you shouldn't, because you're
Yeah.
not peer-to-peer.
No. You're a coach. You're a teacher.
Yes.
You're their,
By
role model.
By
Like you said a while
definition,
ago.
you're an authority figure.
That's it. That's a great word.
But
Yes.
you're teaching
it's a
them
power. Yeah.
to be responsible. You're teaching them to be respectful, and you're teaching them an education or teamwork.
Absolutely.
That's it.
Yes.
You know, but I am a safe place if you need it. But that's, you know.
Yeah.
But the reality is there's evil people out there who take advantage of
Yes.
that. That's just the
Absolutely.
reality.
Yeah.
Okay, while we're discussing things that might not be on there. With this attendance policy, because remember, I know nothing about nothing, because I'm in Alabama and I just saw what was put on all over the internet. What does that look like if a child needs to leave school during the day for doctor's appointments?
Well,
Because I was heard a school excuse doesn't work anymore.
So we take a common sense approach to it. Okay. So the way we say it is, if you have to make your appointment during the day, maybe make it in the morning where you can go to your doctor or your dentist and go to the appointment and then come back.
Because I'm just looking at
The
me like
issue-
I can't see everybody because I only work till 4:30.
So the issue
you know what I mean?
is-
Like, what do I need to do?
So the issue is with the attendance, and to be I'll be honest.
Yeah.
It in ways ties into what we're talking about.
I didn't know
the
if I could send a
issue-
letter. I don't know. You know. I don't,
Yes. Yeah.
Well, the
Okay.
issue
Yeah.
is this, is that it's got to the point to where, and we'll just say doctor's appointments, to where a kid gets up, doesn't feel
Yeah,
good,
yeah.
whatever the case may be.
I understand why it came in place.
Right.
Because I have kids.
Yes.
Right.
And
Yes.
all the time my stomach hurts.
It's just
you know.
that's exactly right. So our way of addressing it is saying, listen, get up and go to the doctor's appointment in the morning, or if you got a dentist appointment or something like that, to where maybe you can salvage part of the day.
Well,
And
also, I am going to offer telehealth visits. And so, like, if the parents are okay with, some kids do it at school in a counselor's office.
Yeah.
You know, like just to check in, those kind of things, just so they're not missing school. So I
Sure.
didn't know if I'm just looking at how I can work and how I can help and what I can do.
Again, the school system is taking
'Cause I don't wanna offer
common
something that's
sense-
not available
a common
if I
sense
can't.
approach to it. You know, if a child has a legitimate, maybe they're a sickness, you know, something that they're dealing with that's long term.
Yeah.
You know, it's
I
not
know.
an issue.
I have a
It's-
kid
it's
that experiences
purely-
epilepsy, and so obviously
Yeah.
that child can't control
Yeah.
when they
Right,
have
right.
seizures,
Yeah.
And then it results in multiple days of recovery. So that child has a chronic absence
Yeah,
form
right.
completed,
Okay.
and it's on file at the school.
I mean,
Yeah.
I don't think but if they're having suicidal thoughts, I would need to see them weekly. You know what I mean? Like,
yeah,
anyway.
absolutely.
What's
Sorry.
rewinding is
Sorry.
no, you're good.
That's a good
I mean,
question.
that's listen. All that is helpful. That's the whole point of doing this. We want to give parents access. We want them to understand, and we want them to see to where if there's anything going on, you know, what can we do? You know, so and we want to help as a school system. We on the private side, but as we're starting to kind of wind down, let's just talk about the overall stigma of mental health. How the stigma of it keeps from conversations happening. How can we as a school system on the private side, parents at home, how can we just absolutely just say, listen, nobody's home is perfect.
Absolutely.
Everybody has problems. And not be afraid to have the conversations. How do we do that?
Well, I just want to start by, like you said, nobody's life is perfect, and people a lot of times are afraid to disclose the skeletons in their closet, or like even with me, they don't want to tell me their past drug use, and I'm like, I want to know because I need to know that you've done this, how you reacted, how you felt when you did this substance, because that helps me figure out how your brain is working. Same with like home life, like there's not anything you can tell me that's going to surprise me that I haven't heard or seen or dealt with, but that we're not judgmental. We're not here to judge your parenting. We're not here to judge how you run your household. We're here to be a resource. We're here to help you to develop tools, because I know raising my first child versus my third child, I've learned a lot of things in life. There's a lot of things I sweated at first, and with him, I'm like, it is not work, you know. And each person, but we're especially trained in these areas.
Yeah.
And that nobody's gonna, the only time I tell all of my patients, the only time I will tell anyone or break your confidence is if you're harm to yourself or others. Other than that, I am team you.
Yes.
Everything you tell me stays in those doors, and we will work it out together. And when we're a team, and the same with them.
Yeah.
Is those are the only times I have to report.
Yeah, absolutely. I mean, it's across the board. I would say that I think what we still struggle with is like just a perception of what therapy is, or of just getting help, period. Because I know a lot of people who just assume that, oh, I've said I was going to, or I said that I was having suicidal thoughts, that means I'm going to be put in hospital. Not necessarily.
Correct.
Not necessarily. We're going to assess. We're going to screen. We're going to talk through it. What does it look like? Because those factors matter. And I think what most people are scared of when they don't they're afraid of disruption. They're afraid of judgment. I'm glad you said that. And so, and there's an idea that somebody's judging me, or just them judging themselves because they think like I should have this together. Nobody said you had to. Yeah, it was just that you just had that negative automatic thought telling you I needed to have it together, and you don't have to.
Right.
Absolutely.
So.
Right. You got a last thought, Khearra?
I do. Actually, not related. It is related to therapy, but collaboratively. There is a mental health stigma, and it does apply to therapy, but it also applies to medication. It is very commonly misunderstood because of past experiences that parents have had with their own medication. There's a lot of parents that, even millennials, so they were put on medication in the 90s and it made them a zombie, it made them lose a lot of weight, it made them gain a lot of weight, just had them all over the place.
And I don't want my child to feel that way.
And they don't want their child to feel that way, which is admirable.
Absolutely.
However, we are in the year 2026, and medication management has improved significantly. Providers now have so many years of research and understanding of how these medications can and do affect different people. They are more adequate at prescribing the correct dose.
Absolutely.
They are better at recognizing when it's not working. Most of the time, people have more frequent follow-up appointments. And so that kid can be on that medication for less time if it is having an adverse effect. We also have gene site testing, which a lot of people are unaware of. But gene site testing, if you've tried a couple of medications, you know your kid has this issue, but these 2 meds aren't working, and you just don't want them to go around and around and around with meds. We have gene site testing. Gene site testing can help identify meds that are appropriate for your child.
And I'm glad she brought up the medication management, because so many family nurse practitioners or physicians or pediatricians have been having to manage these medicines in this area because there's just not resources. And that's why it's so hard to understand me versus them. But I specifically deal with those medications
Absolutely.
and those diagnoses and knowing when it might be appropriate. And my goal is to be on the least amount of medicine to be the most effective.
Yes.
And it's not that you have to be on them long term.
Exactly.
It could be a
Exactly.
short term thing, and it's not like. But that's where we come in as a team and we work on it. What do you think? How do you,
Yes.
you know, and I want the parents' input. I want the patient's input, because I don't just treat children, I treat adults also. But for so many years, they've been treated with the wrong medication and they feel so bad.
Yes.
And then
Yeah.
you get them on the right one and they're like, well, did you change my life? And I'm like, well, no, you're just on the right medicine.
Yeah.
The medicine's doing the right job. I just recognize your diagnosis is wrong.
Yes.
And that, but that's all you have, and that's all you know, and hopefully more things will come to this area.
Yes.
And because you are getting all this funding and
Well,
all this.
the point is that there are, in 2026,
Yes.
there's a lot of resources. out
Yes.
there.
And
There are.
medicine is better, and
It is better.
and it's got less side effects,
Yes.
and it's and like you said, hopefully you don't need it long.
Exactly. And some of the things that were commonly prescribed in the past are less commonly prescribed now for
Absolutely.
those reasons. And so it comes down to having open discussions with your medication provider, but first you have to give them a chance to be involved. And seeing students who very clearly have certain diagnoses and knowing that that is affecting them behaviorally, academically, socially, and knowing that her specific assistance would be a game changer for that student, that it would help address those issues that I can help with up to a point.
Right.
It would improve the therapeutic experience.
It would improve their overall experience, because sometimes things are in need of both interventions. There are some things that therapy alone, it can stand alone.
Yeah.
And there are some cases where medication can actually stand alone.
Yeah.
It would still be benefited by therapy, but
And
it could
yes,
stand
and
alone.
I will always, I keep hitting this microphone. I will always tell every patient, therapy. And like, we're composing a list of resources in this area so I can provide those for my patients, because I can't do this alone, because medicine can only do so much.
Yes.
We have to change the way our brain works. We have
Yes.
to change how we our coping mechanisms, and we all already have coping mechanisms we don't know we use, but let's make sure they're positive ones
Yes.
and not negative
Yes.
ones. And but as we go back to like things you see in a child, when I start my assessment, I look at childhood and we go all the way up back,
Yes.
because that's when symptoms start. And I'm like, well, do you ever remember your tummy being nervous as a child, or you being sick? And they're like, yes, I do. And I'm like, well, that was anxiety.
Yes.
But you don't know that, or you don't know you're avoiding these situations because, oh, that's why I felt that way?
Yes.
Because you can't put a name to it.
So if we are able to get parents to buy in to this additional resource, it can actually have a significant effect on our students. And I'm not saying that every student needs to
No.
be medicated.
And I'll have lots of people who come to me and they leave without medicine.
Yes.
Because that's not what you need at that
Exactly.
time. I'm not going to push pills.
Yes.
But I do want to make sure they get the correct diagnosis and they get the correct treatment.
So being open to therapy plus meds, that would be so valuable for some of our students.
And recognizing it as early as possible.
Yes.
Yes.
To start to start helping the
Yes.
child. As soon as you can start recognizing
Yes.
the
Yes.
things that we've discussed today, whether
Yeah.
it be physical changes, mental changes, emotional changes.
Absolutely,
The
yes.
sooner we recognize that and the sooner we get involved in the kid's life, the more impact it's going to have and the better off
and
they're
that's
gonna
what a lot of people are like, because I'm like, do you have a 504? Do you have an IEP? And they're like, well, no. And I'm like, not. But the resources are there.
Yes.
Let's get these kids in speech therapy. Let's get them in occupational therapy. Let's get them in, because we want them to be the best version of themselves. And you start young, and like you said, well, we say, oh, autism, y'all didn't have it back in our day. We did.
Sure.
And I have adults coming to me wanting an autism diagnosis just because I knew something was wrong, but I couldn't put a name on it.
Yeah.
Now, I cannot diagnose autism. I want to
Yeah.
put that out there
Yes.
because I get asked that all the time.
Right.
But hopefully we can get some resources to make that better available, and we're looking into that.
Well, first off, I want to thank all three of y'all for joining and being willing to do this today, because I think it's a great thing to make parents and people aware, so that they can pay attention and catch on to when things just doesn't seem right, and be willing to step up and say something and try to get help. So thank y'all for what you do, you two for the school,
Yes, absolutely.
and
The world needs more of y'all.
and Margo,
Thank you.
I think it's great that that One Stop Medical has taken the step to
Yes.
have someone that on the private
They're
side.
putting a lot of trust in me also.
Right. So, but I think it's been a great discussion, and I am super excited for this to be put out, because I think it's going to make a difference. And but for us at Local 43, and you'll be able to catch us on many other platforms. And thank you for joining us today. And with May being Mental Health Awareness Month, spread the word, and don't be afraid to have a conversation with the ones that maybe are struggling or whatnot, because the only way that we're ever going to get past any of this is to address it on a daily basis, where we live life in an open and honest way. So again, thank you for joining us, and we'll see you next time.